name is Kacey Schoepp. I'm a BSN RN in hospice at Crossing Rivers Health. I grew up on a small dairy farm, and it always just taught me a lot of values that I hold true till today. Our whole family was very tight-knit. We treated our cows as though they were family, and I thought, oh, maybe I wanted to be a vet someday. And then unfortunately my grandma got sick around when I was 10 years old, and she fought her battle with cancer was very aggressive, and she fought it very strongly, but hospice was involved. And since kind of that introduction there, I've just always wanted to be in hospice specifically, so of course nursing came with that. I really pride myself on focusing on the patient and the family. Making those true relationships really gets us to individualize each care plan and each family, treating each person as though, making sure that they're acknowledged and their wants are heard and followed through on, trying to get their wishes known. Of course, coming with that always comes symptom control. With your final days usually does come more pain, anxiety, depending what disease that you're battling. We really just try our hardest to make people comfortable, most people in their home, because that is their goal, to stay in there. So we really pride ourselves on making those relationships with not just the patient, but with the family, and just doing our best to keep their goals met. It's definitely very fulfilling. That is one word that I could use to really just describe our whole team as a whole, hospice as a whole. And I believe that with us being a smaller, tight-knit hospice, we can talk to each other more. We're all on the same page. We work very closely as a team, which I feel is a huge benefit. And so fulfilling to not only the staff, but also to the families and, of course, the patient, that, even though they are struggling with many different symptoms or maybe emotional or spiritual distress, we can use our tools the best we can to try to make them as comfortable as possible. Trying to get people to smile is really important to me, and keeping true to my promises as well. We can't always necessarily promise the mountains, but we can maybe promise, getting out on your porch or something. Just making those realistic goals and helping families and patients achieve them.